Aloha everyone, and welcome to the Hawaii Pacific Gerontological Society's January webinar. My name is Mapuana Ta'amu, and I am one of the board members for HPGS and chairperson for these webinars. If you haven't already, please consider becoming a member of HPGS so that you can stay updated and invited. There are various rates for individuals, organizations, and associates. And a few membership benefits include our monthly newsletter that is filled with age-related news, events, and activities. We have these monthly webinars that are presented by professionals and are free to our members and their friends. We also have quarterly general membership meetings and other events that bring HPGS members together. We proudly offer scholarships for those pursuing education in gerontology in the field of aging. And our website at hpgs.org provides a plethora of resources for everything Hawaii kupuna related. Following this webinar, it'll be uploaded and archived to our website. But for more information on our membership, you can go to hpgs.org and in our memberships tab, this is the screen that will show up. You scroll down to the bottom and click a button. And you'll find this page to sign up. You can renew, or if you're a new member, just click in the button here and fill out the information. Submit is at the bottom, and you'll receive our first newsletter when you sign up. Back to hpgs.org. This is how you will find our archived webinars. It's here in the webinar tab. So if you click down, it'll take you to this screen. Scroll down, and there's all of our past webinars that we've done. If you click here to watch button, it'll take you to our YouTube link. We also have a YouTube channel. And if you subscribe to our YouTube channel, then you will receive email updates on when we post these. Now let's get down to business. We've gathered here today to talk about brain health and dementia. Huge thank you to the many of you who have submitted personal questions that you have about brain health. We will get to those towards the end of this webinar. But if you do have any other questions, during the webinar, there is a chat box you can use to type in your questions or comments throughout this presentation. Dr. Balaz also wanted this to be more of an interactive session, so please get familiar with the chat box. If you do have problems, you can send me an email at hpgsmembers@gmail.com, and I'll try to check that to troubleshoot anything. If you need the chat box, I'll show you where to find it, things like that. So please get familiar with the chat box, type in hello so that you know it's going out to all versus just me. Just play around. Now, I'm sure many of you have heard the word dementia and have an idea of how terrible of a disease it is. Today, I've invited a special guest with expertise and passion for neuroscience to educate us about how to keep our brains healthy and some information about dementia. Our speaker today is a lovely Dr. Pokii Balaz. Dr. Balaz is a local girl who grew up in Hawaii. She attended the University of Hawaii at Manoa and received a Bachelor's of Science degree in nursing, along with a leadership award for her service as class president. Dr. Balaz received her Master's of Science degree in nursing education from the University of Oklahoma. She graduated with honors and was inducted into the Sigma Theta Tau Honor Society. After working in Los Angeles, she's returned to Hawaii to obtain her doctorate in nursing practice from the University of Hawaii at Hilo. Dr. Balaz describes herself as a lifetime learner and is double board certified as a family nurse practitioner. Dr. Balaz is also a full-time caregiver to her father who has Alzheimer's disease. She facilitates a support group and co-facilitates the Savvy Caregiver program, which helps to address the needs of caregivers. Dr. Balaz, thank you for being here today.
Hi, everybody. Good morning. Thank you for having me. I'm happy to be here with all of you. So today we're just going to spend a little bit of time. And thank you to Mapu for that wonderful introduction, as well as for HPGS having me here. And please excuse me, it's the first time that I'm going to be doing a webinar with an actual camera on me, so I'm going to try to remember to look that way. And I do kind of want this session to be interactive, and hopefully if I'm able to come back in the future, it can be even more interactive. I like having discussions. So the first thing I wanted to ask everybody before we get to that part and before I start the presentation is if everybody can type in their chat box what they think or feel or your own definition of what brain health is.
Well, it looks like people are saying good morning. Thank you, Monique Peacock. Cecilia, hi. Aloha Balaz from Kimberly Cooper. Good morning, aloha everyone. Judy Taketa, keeping brain stimulated with doing activities, use of right brain and left brain activities.
Okay, everybody. So today we're going to talk a little bit about what dementia is, how it affects the brain, why brain health is important. Kind of going to go over 6 pillars of brain health, self-care for caregivers and resources, and kind of tie it up how brain health will help those with dementia as well as the caregivers. This webinar is going to be a little bit more of a general overview, so we're not going to go into depth about any kind of the 3 subjects that we're trying to tie together. Hopefully, maybe in the future, we'll do more in-depth webinars on each topic. So let's get started. So what is dementia? So many of us know the answers to this. So it's not just, it's an umbrella term, first of all. I'm sorry. And we can think of it as somebody holding an umbrella and with people standing underneath, right? So if there's 5 people standing underneath, and one person would be Alzheimer's, one person would be Lewy body, another person would be vascular. So it's not just a memory problem or a personality disorder. It is global deterioration of the memory and cognition. It affects a person's range of thinking, not just their memory, and it'll interfere with social functioning. So this is a lot of times when the person with the disease starts to becoming cut off from the world. And just like people with the disease, so do many caregivers. And then one big thing I still want to emphasize is that it's not a normal part of aging. I think a lot of people will still have that perception, or will say like, oh, my mom is just getting old, or dad, but it is not a normal part of aging. And a quick way to kind of think about it is all of us misplace our keys, our phone. I'm guilty of that all the time. But most of us can retrace our steps or kind of sit back and think, what did I do yesterday? Or where was I this morning? Where a person with the disease is not able to do that. And I see other people answering, which is nice. So from Cecilia, I think it says, she's asking if it's considered inherited. We'll get to that. Another answer from Anne for brain health is the ability to continue functioning and being able to read, study, learn, pray, and laugh. I like that a lot. Thank you guys for answering. So some types of dementia. I'm sorry. Excuse me. I'm not going to go over all the types of dementia, vascular and Lewy body, but I am just going to address Alzheimer's disease, which is the most prevalent, and then vascular is usually coming next. So what is Alzheimer's? It's a type of dementia. It is progressive. It interferes with the brain's ability to send and receive messages. What happens in the brain is there is an accumulation of proteins in the brain, the beta amyloids and the tau tangles. It'll affect memory and language first. So it does affect executive functioning. Eventually, it'll affect all brain functions. And yes, there is some hereditary influence, and age is a main risk factor. So the older you get, the more likely. I think it's about 1 in 5 for those 65 and older, and it jumps into 1 in 3 if you're above 80. So to answer the question, hereditary can be part of it. Researchers hasn't found one specific thing that'll say that you will get Alzheimer's, dementia. It's a variety of things, but there are genetic tests that you can do to see if you have the APOE gene, and that can tell you if you have like a 12-fold risk or 8-fold risk. You can see what your risk may be. Like my grandfather had it, my father has it. I'm a caregiver to my father who's in end stages. I take care of him at home. He asked us to let him age in place, which I decided to honor. So he's nonverbal, he's bedbound, and I'm a first-degree relative, so I'm at very high risk. So that's a little bit about how I got into this field too, but that's to answer that question. Okay, so some of the things, so early symptoms, we're gonna look at some of the issues that they have or recent conversations, problems with names, events, depression, and apathy. Some of the late symptoms are like impaired communication, poor judgment, confusion. But when I say confusion, I do want to let everyone know that confusion starts for the entirety of the disease. You know, symptoms or the disease starts about 10 to 20 years before symptoms show. So they live in a state of confusion constantly, which is a lot of times where the repetitive questions come from. the uncertainty, a lot of the things that they do. So difficulty with speaking, swallowing, and walking. The diagnosis, it always starts off usually with family, friends, who start noticing that there's some kind of memory problem. And then they at least have one other symptom: difficulties with social functioning. They have a change in personality, impairment of abstract thinking, disturbances of other thinking processes, and impaired judgment. So we have the accumulation of plaques and tangles, and these changes are eventually accompanied by the damage and death of neurons. So I just wanted to show everybody this one website. Two computers here. So I just wanted to share this one really quick. So this is from the Alzheimer's Association, which is always a great resource. And for people who want to learn a little bit more about what's going on, they have this great brain tour. So they have part 1 and part 2. And so part 1 kind of just briefly goes over the brain, 3 pounds, 3 parts, the supply lines. I'm not going to go through everything on here. I just wanted to show everybody because I think resources are the most important, education and everybody being able to find the information. So if you click on these, it'll show you what part of the brain is being affected. And we were having a comment about left left brain and right brain, and so they do go over that too. They talk about the neuron forest, cell signaling, which starts to cover the synapses, signal coding. And then after you finish that part, they also have part 2. And I like this part really good because it shows you how the brain, how the disease affects the brain. So we begin with the brain without the disease, advanced Alzheimer's, and then when the two brains compare. And I think that's a really good visual. Then we were talking about the tau tangles and the beta amyloid plaques. And so they have a section on here where you can read just a little bit more about it, how the plaques and tangles form, how exactly they damage the cells and the signals between. We can start looking at the progression through the brain. So obviously my father has severe Alzheimer's, so he'd be the brain on the right-hand side of your screen. And then at the earliest stages where it starts to affect the learning and memory, the thinking and planning. Okay, so I hope everybody will be able to take some time and just kind of go over this. It really, really does help. It's interactive, it's fun. I like those kind of resources. And so now we'll return back to the PowerPoint. Okay, so we're just going to go over some brief facts and figures. So nationally, there's about, by 2050, there's going to be expected to be about 60 million with Alzheimer's. Now, this is from the Alzheimer's Association Facts and Figures, but I've seen other estimates as far as high as 135 or more. So it'll be interesting to see what it is. It is the 5th leading cause of death for those greater than 65. The 6th leading cause of death for all adults. As of right now, there is no cure. The cause is unknown. It is thought to be a combination of factors. And at this point in time, we are unable to slow the progression of the disease, which usually brings up a comment about medications. So medications are helpful. So the sooner that we can get somebody on medications, the more helpful it is. Medications don't stop the disease. The medications at best will help slow the progression. So a lot of people get that confused also. And at best, the medicines can take the person with the disease back about 6 months to a year. But it is not a cure, and it will not stop the disease. This disease is progressive, and it is irreversible as of right now. Although a lot of research is being conducted, and we'll have to wait to see what comes out soon. So how can we help those? So I'm going to spend a little bit of time on this slide, and I'm sorry that I should put pictures and next time, but for caregivers out there, professionals, people who are dealing with people with the disease, and even in the support groups, one of the first things we talk about is acceptance. Well, what does acceptance mean? So caregivers, family members, one of the biggest things is to accept the disease. And that just doesn't mean just to acknowledge it and say, yes, I know that mom or dad has Alzheimer's, to really accept the disease and to understand it, meaning that understanding that the person with the disease has no control over the disease and that the disease is in control of the person. So those repetitive questions, the things they're doing is not mom and dad. They're not doing these things on purpose. The disease is causing these things to happen. And your responses, your reactions our reaction to the disease. The disease is controlling not only the person, but in some ways controlling the caregiver, the people that are caring or helping with the person. And just some quick tips. And again, this webinar is not to go in depth about this, but one of my quick tips that I will always remind people is never argue with them. Because to this day, we haven't found anybody who's won an argument with somebody with dementia. And it really is because they have their own reality. So they're not lying. They're not saying things that aren't true. Whatever they're saying to you is really what is happening. So for instance, like if you look at the wall behind me, it's white. All of us see that's white. But if a person with dementia says the wall is purple, you just go along with it and the wall is purple. There's no changing it. That is their reality. That's what they see. Just like with hallucinations and delusions. So to try and tell somebody that something is not happening in their reality causes more of a conflict between two, and can cause the arguments to continue. So we have to remember to step into their reality, not expect them to come into ours. We want to assist them and help them. Sometimes I think as caregivers, it's faster if we do it. It's a little bit easier, but we need to step back and still let them do what they can. Engage with them. And one of my biggest things is that all behavior has meaning, meaning that a lot of times people are called combative or non-compliant, or they have behavior issues. And it's really, if you step back, I tell a lot of my caregivers to keep a diary of what happened, because when a behavior is happening, that's usually because something precipitated it. Something happened before. And a good example I would use with a lot of my CNAs is that when you're going to bathe somebody, they would say, oh, the person's combative. And I said, if you think about it and the person is laying in bed and 4 or 2 strangers come to you, what would you do? If 2 people you didn't know came to you and started pulling off your clothes, you would automatically fight back. So they're just doing human instinct. So I think a lot of times we need to go into their shoes.
Question. I think they're asking us to mention the same thing as.
So this schematic is just a little bit of all the areas that dementia affects. Again, I'm not going to go into in depth about this. This will be for another presentation, tune in for later. But I will just quickly go over a couple examples. So abstraction is a really big one. So a lot of times caregivers will say, oh, Mom, I told you, we're not going to dinner with Uncle until Friday night. But time, and that's an abstract thought. So a lot of times what I will tell my caregivers is, don't tell your mom or your other half or whoever you're caring for, your care recipient, things in the future. They basically live in the present. So if you know that mom takes an hour to get ready, then you want to tell her 1 hour before it happens. Like, Mom, let's get ready. We're going to Uncle's house for dinner. You want to give them options, the blue shirt or the red shirt, not 10 different options. We want to try and make things as simple, but still engage them, make them feel like they're part of everything. And you'll find that when we can develop these relationships, it will make things easier, not only for the person with the disease, but for the caregiver also. Okay, so why are we going to start talking about brain health? So brain health is kind of in the middle of this webinar. So we talked about dementia. Now we're going to look at brain health, and we're going to talk about caregivers. And brain health really ties in with both groups, because one, the brain health can help you reduce the risk of getting dementia, and then brain health can also help caregivers maintain optimal functioning. So when we're talking about brain health and this wave that's kind of going across the nation, and everybody is getting into this, it's not just for people who might be at risk or people who want to reduce dementia. It's also for people who do not have any issues with their brain and just want to keep it working at the best that they can. So it's for people with issues and those without. So again, why? The prevalence is growing, awareness is growing, desire for healthy lifestyles. People are wanting, more complementary therapies or alternative therapies. They want to maintain healthy brains. They want to remain in optimal health, and they want to do prevention. So what does brain health look like? So I think some people answered, and I'm so sorry, I can't see the answers that were earlier. Did you see any of the other ones for what people thought brain health was? But brain health encompasses a little bit of those things that you can see on the slide, such as exercising, education, to not smoke, sleep, mental health, social engagement, and to challenge yourself.
So we got this one.
And so other people are saying keeping your brain stimulated is ability to continue functioning. I agree, being able to read, study, learn, pray. And some people are asking about taking supplements. So we'll get to that a little bit later in the talk. So lifestyle changes. So when we're talking about brain health, we're talking about adapting key lifestyle habits. So we want to combine brain habits if possible. There's a lot of different ways to affect the brain, and so we want to try and optimize as many as we can for maximal benefit. It will help us to maintain and improve age, and we want to start now. So I've had patients tell me before, oh, you know, but I'm already this age, what difference will it make? And you guys have all heard this. I tell them all the time, starting now, just start now. It will make a difference. It doesn't matter how old you are. It doesn't matter what your lifestyle has been for the past 50 years, 40 years, anything you do will help now. So we're going to talk about the 6 pillars of brain health. And the 6 pillars include physical education, food and nutrition, medical health, sleep and relaxation, mental fitness, and social interaction. And I wanted to show everybody where this is coming from. So the 6 pillars, when I was at the clinic in town and we opened up the Brain Health and Wellness Clinic, we really tried to model it after the Cleveland Clinic. So I'm going to take you to their website really quickly to just kind of show you where you can go and find these resources, and they do have a brain checkup. So this is the Cleveland Clinic, their Healthy Brains. Mm-hmm. And so if you can register, and I've registered. I'm not going to share my brain health profile with all of you guys today. I even made my boyfriend do it, so maybe I should share his. But so you can register for a brain checkup. It goes the steps. You can answer questions about your lifestyle. You'll get a brain health index score and report. It'll kind of tell you where you're at and things you can do to kind of bump it up. You can use your dashboard to track your progress and test your memory. So I like more interactive tools than just, we're doing a PowerPoint and you guys are hearing me talk, but then resources for you to go back after and to look at yourself. So I would highly recommend everybody to sign up and do a profile. It really doesn't take that long. It's like 5 minutes, answer some questions, then kind of give your report, and it's really interactive that you can continue to go back to. This is what we're going to be talking about today, the 6 pillars of brain health. And this is where it's coming from. So I'm going to do a quick overview of these. And this is what we modeled things after. So we have physical exercise, food and nutrition, medical health. And again, I'm just going through this a little faster because I'm not going to stop and click on anything. Sleep, relaxation, mental fitness, social interaction. And, a lot of these pictures are older and seniors. And so some of my patients would ask, oh, but I'm only in my 20s or my 30s. And I would tell them the earlier we start, the better. This isn't only for people who are kupuna. This is for all of us, no matter our ages. Okay, and now I'm going to go back to our PowerPoint. Thank you. All right, so let's start. I love this picture. It's like one of my favorites, the brain and the heart walking together. So as we all have heard before, what is good for the heart is good for the brain. And that's very true, and we're finding that out through research. And so a lot of people always think of the heart as the main part, and I think we need to kind of bring it back in that the brain is that source also. And so we're going to start off with talking about physical exercise. So it's valuable to prevent disease and overall health. I think we can all agree. It's associated with lower cognitive decline. It increases blood flow to the brain, and we very much want that to keep everything clean and clear up there. It will increase your mood. It'll reduce risk factors, hypertension, diabetes, hyperlipidemia, and preventing falls. And I think this is one that a lot of my seniors forget, that this will really help with preventing falls. And this is one thing that I've made my mother do because her balance is a little off. I'm not even gonna lie, mine isn't the best either. I cannot do a balance beam anymore, so I'm working on this myself. And if we go so when we're talking about this, though, we want it to be mentally and socially engaging. We want you to enjoy it so you can continue to do it. And some things are like bike riding, swimming, walking your pet, Tai Chi, water aerobics, yoga, Pilates. Enjoy the benefits for a lifetime, and it can be aerobic, non-aerobic, and a combination. And just to start now, But when I say this, it doesn't have to be any of these things that you see on here. It can be a combination. And I always want to tell people to start small. Don't feel like you got to do all of this. You start small. We all hear about that 5 days a week at 30 minutes a day. And when I'm with my patients, I really start off small. Sometimes I will talk to them about, let's just start at twice a week at 30 minutes. Just pick one thing you want to do. We want it to be consistent. We want it to be fun. We don't want it to be overloaded. And also tell them all the time to make it fun. Like, wear your bright colors, or if you're doing laps in the pool and you're getting bored with going back and forth, start going zigzag around the pool. Go in a circle. Throw some water in the air. Wear, a bathing suit with bright colors. Whatever you want to do to just make it fun. A lot of times people want to do it together, and that's great if you can do it with people, or go to daycare centers. I know Kapuna don't like that name. We got to change that. Or, going to Kapuna programs, and a lot of times they'll exercise together. Saying that too, you can do exercises in your chair. And so if you go to the National Institute on Aging, their Goal for Life program, you'll find a lot of exercises. And so some of the things that I ask people to do, my patients, to just sit up straight in your chair. You can take a squeeze ball in your hand, hold it for a few seconds, release. You can also put your feet flat on the ground and just lift your feet up. Keep your heels on the ground, lift your feet up. That's a calf stretch. One big thing, have you guys ever noticed that seniors, when they get out of the chair, they rock? They do the 1, 2, 3, and then they stand. So to help with that, we ask a lot of them while they're watching TV to just cross their hands over their chest and to just stand up and sit down. And that really helps develop these muscles to keep it going. So you can do exercises also while you are watching your TV or between commercial breaks. And there was one last thing I wanted to show you. We don't have to show you. If anybody wants to Google, you can just Google portable bike pedals. Walmart, Amazon has them. And so if you can't make it outside, you can put that down. It's just the pedals, and you can watch your favorite show, and you can just pedal away. You can also put it on top of your desk and use it to work out the arms. Soup cans is another great thing to use for dumbbells. You can use while you're watching TV. So there's a lot of different options we can do. So why are we going to do this? How does it help? Well, it'll improve memory. It'll build endurance. It'll help with strength training, flexibility, and improve balance. Okay, the second pillar we're going to talk about is food and nutrition. We're all kind of really familiar with this. I don't like using the word diet. We have a lot out there, DASH, Mediterranean. A lot of people who are hypertension are probably familiar with the DASH diet, but I'm going to show you another diet that I've used a lot with my patients. It's called the MIND diet. It came out of Rush University. It is ranked the 4th best overall diet. It's still fairly new. There's an emphasis on the green leafy vegetables, berries, and whole grains. The reason why I like this one a little better is it's not too overwhelming. It very much focuses on the whole person, or the whole, not just like particular parts of the diet. And so here it is. This is the MIND diet. So as you can see, it's very simple. I do this with my family. We do this at home and with patients, and I usually will print this out, and they can check it off as they do it during the week. They can write their dates down. And again, I start small. So we'll usually agree on one thing to start off with from the what to eat list. So if they're only doing berries once a week, I'll say, okay, for this next week, can we do twice a week? And the next week, can we add in fish? And then we'll look at what to limit. And if they tell me they eat red meat 5 times a week, I'll say, okay, then do you think for the next 2 weeks we could do 4 times a week? And then just start to go down. So with this diet, they found that if you adhere to it very, very, very stringent, you can decrease your risk by 50%. If you kind of pay attention to it, you can decrease your risk by about 35%. So how does this help? It'll reduce your risk of getting Alzheimer's, decrease your risk of degenerative diseases. It increases your antioxidants, good fatty acids, reduce inflammation. It'll help you try new foods, enjoy time with friends and family, and food is medicine, which is one way I think most of us don't look at it, but food is medicine. So if we give ourselves the proper food, then our body will be able to run at its optimal self. And honestly, this came from my kumu, where I'm learning La'al right now, Hawaiian medicine, and that is the first thing he told me is food is medicine. Again, have fun. So what I do with my patients is I tell them, like, I've had my patients who play poker with their berries, raspberries, blueberries. They have challenges who can make the most colorful food. People don't like brown rice. They've made pictures on their plates with it, you know, just however you want to do it, just make it fun and interactive.
Yes.
Okay, so the third pillar we're going to talk about is medical health, and this is really talking about your overall health. So if you have anything else, osteoporosis, diabetes, any cardiovasculars, please follow up with your specialist, your primary care, because the one big way to take care of your brain is to make sure that you take care of all your other issues that are happening with your health. So it'll help, again, reduce or decline in brain function, dementia, cholesterol, brain injury, depression. Very much will help you to stay sharp, increase your vitality, and increase your quality of life. So the next pillar we're going to talk about is sleep and relaxation. This is like everybody's favorite. And so this will really help to energize you, improve your mood, stay positive, reduce those plaques and tangles, fight depression. And if we all can think about it, right, all of us, if we get a good night's sleep, wake up feeling the best. And so I think this is like everybody's favorite part, because when you think about relaxation, everyone thinks about the spa, laying in your tub, and those are perfect ways to do things. Also, to de-stress, some tips, and you can find more of this on the website, is to just focus on the present, to continue to make a list of what's bothering you, to take 10-minute breaks when you're doing something, and do something stimulating, some jumping jacks, some visualization, some meditation, which can be some breathing or imagery, your stress ball. Don't dwell on things, and always focus on the specific problem. So how will this help your brain? All of this helps you build your brain reserve. So to help you to adapt and respond to changes, resist damage. This starts developing in childhood, and it gets stronger as we go through adulthood. It helps if we continue to learn, embrace new activities, develop new skills, interests, and building and improving their brain reserve. And again, by building it, how does it help? Better mood, sharpen your brain, self-esteem, taking risk, sharpening your brain. And meditation is one thing a lot of people are getting on, but a lot of people are still not doing. And there's a lot of research going on about it, and it'll really help to recenter and focus. A lot of research showing that people who are doing this are happier, healthier, able to handle stress better and adapt. And so it's one area that I would really suggest, and I really encourage my patients to get into, and I'll even do it with them when they're in the office with me. There's my little picture of the brain. All right, so mental fitness. This is kind of everyone's favorite. This is what everybody wants to go to as soon as we start talking about this. So we're talking about mental fitness. We're talking about continuing to do what you are doing, but then we want to add something new in there. So you want to learn a new skill or a new hobby. Some senior or kupuna decide to go back to night school or weekend or just take a class for formal education. You don't have to. You study or participate in activities, joining a book club, joining the YMCA, going to a daycare, or like Alulike has kapuna programs or Project Dana. So you can challenge yourself with games and strategies like Luminosity. There's also free apps, and you can choose activities that you like. So very much all of these things that we talk about, I always gear it towards what people like to do. So we have to talk about your interests and what you like, because if you don't like it and you don't enjoy it, you won't keep doing it. Music and art is a great thing. They have all those you can sign up and do like those painting classes. They've been very popular the last 3 years. So a lot of times when the families come together, I'll start doing like game nights where the grandchildren, so intergenerational, will come together and play cards, checkers. We have game night in my family once a month. Everybody comes together and plays games. About twice a month we do things, but one of them is game night. And the kids learn some of the old school like backgammon that my mother made us play, and they have no idea what it is, but it's a lot of fun and it brings the family together. So how does mental fitness help? It'll help you develop new skills, new interests, fight mental decline. It gives you inspiration. It'll increase your reaction time, which is something that is very important in your problem-solving skills. Social engagement. So this is a big one. And we have to remember with our kupuna, a lot of their friends and family are no longer with us. And sometimes we start feeling alone, going through that with some of my aunties and uncles. But social engagement is very important. It'll support your brain health. It'll delay dementia. You can join a club or volunteer, community center. And so I have a story for this one. So my mother was starting to feel guilty about leaving my father when I returned home to care for them. I was living in the mainland, and my mother called me home to
take care of my father. She felt she no longer could. Well, I started noticing that she would stay home, that she didn't want to leave without him, and they very much had the type of the relationship. They're known as the kissing couple, the couple that was always in love. They did everything together. Well, I knew that wasn't good for my mother, so one day I told her, come on, get ready. I'm going to take you out. We got to just run some errands. We're going to stop at the doctor's. And she said, okay. So by that time I had found Project Donna. At the time where we were living, it was right down the street. And so I took her there. And what I did is only because I knew that I could and my mother wouldn't get mad. So I walked in with her, let them know that we're here. She asked me, what is this? I said, oh, I just wanted to check this out. It's just a group. And I got my mom settled, and then I stood up and I said, okay, I'll be back in 2 hours. I left and got her to stay there. It was a support group for all caregivers out there. Very much encourage everybody to join a support group. Project Donna has some, Alzheimer's Association. And so her face when I left, but when I came back, she was having the time of her life. Then after that, I put her in the Kapuna programs for Alulike. And now if I even try to get my mother to stay home, she's like, oh, no. That's my day out. And so, it really does make a difference. It helps them to stay connected, treasure your loved ones, branch out, and be interested. So those are just some helpful tips. It'll help you reduce stress. It's exciting, create new hobbies, meet new people, happier and healthier overall, and pets. Pets are really good to help people with socialization, and even for those with the disease. So when my father, I used to have pet therapy come and play with him. He loved it. And a lot of hospice have pet therapy. And just a little note on hospice, please don't wait until you get that 6 months diagnosis, or please go to your provider as soon as you need. Hospice is not only for the time when they're actively dying, and there are some hospice now who have programs that you can get engaged in before you even need hospice, so that you're already familiar with them. They have outreach services. You're already part of the program, so by the time you need them for hospice specific, you were already with them, and it's a very easy transition. So you don't have to wait. They have things like pet therapy, they have aromatherapy, they have healing touch. There's a lot of things. And so right now with my dad, we don't have the dogs coming anymore. I buy him from Amazon. You can get dogs or cats, plug in some batteries, and they'll bark, and they love it. And it's really interactive. Okay, so now we're going to bring this all together. So we don't want to just look at one facet. We want to look at the whole person. So we want to bring it all together, the mind, their body, spirit. We're looking at Olopono, which is, for us in Hawaiian, it's our health, optimal health. We're looking at the brain health and the lifestyle impacts and the choices, because we all make our choices. But what we really want to do is create a brain span that matches our lifespan. So how do we do this? We start small. We need to understand what you need. You need to understand what you need. The people that are helping you need to understand what you need. Trial and error. We want to have support. You want to do it with a partner if you can. Make it fun. Keep a diary. Keep a video diary. Keep both. Celebrate, and always, always look at the positives. Don't focus on the negatives, or if you've not accomplished your goal, it's okay. Let's just start again and move on. So here we go, caregivers, my favorite. Well, because I am one. And caregiving can be very stressful, how we know. And so brain health very much help caregivers to continue to be optimal and do the best that they can. So we can't forget about them. We have to help our caregivers, education, support, and resources. And so when I'm in the clinic, I very much tell my colleagues that to help the person with the disease means that we have to help the caregiver. We have to help both. It's a one relationship. We can't help one without helping the other. We need to help them decrease their financial, their mental, their physical stress, their burnout, and health. And so I encourage people to always go to senior fairs. Wherever they're being held, there's a load of resources for you out there. So let's talk about caregiving really quick. I think a lot of us need to, this role that caregivers run into, it's not a role that anybody knew, right? Nobody grew up saying, I'm going to want to be a caregiver one day. So it's very much an unexpected role that I think we need to be more appreciative of. And this unexpected role is made of all these things that you see on the screen. At some points in time, they may be this specific role through the whole stages. Other times they may pick up roles, they may drop roles, but this is all the roles that, and this isn't even the whole list, but these are just specific ones. So if you can look at it, a lot of these things people have gone to school for or needed training, and caregivers are expected to do all of this. So for caregivers, we need to appreciate their role. We need to know that it's very demanding, and we want to give them, and very much it comes from the Savvy program, the knowledge, skills, and the proper outlook to have the best journey that they can with their loved one. It is work with a purpose. There's no exact job description. It's demanding. It's a big role. It continually changes. Many roles require training, but at the very least, I think people forget. We always talk about the burdens. It's a very rewarding and satisfaction. And a lot of times in my support groups, I will every few months tell everyone to give me one positive of the disease and one thing that they're thankful for the disease. And it's a very much different way of looking at it. And for me, it's the fact that it helped me get into this field to understand and help others. It also gave me the time with my father. Objectives of caregiving. The person's safety and comfort, meeting their daily needs, contented involvement, which we'll talk about in a little bit, fulfillment, and to reduce suffering. So we want to help guide our care recipients through the day and make it safe, calm, and present. It's one of my favorite pictures. Just looks so happy. Okay, so facts about caregivers. You can see all of them laid out on the screen. Now we know that it's a 24-hour job, so the 46 hours you're talking about direct care, like bathing, feeding, brushing teeth, that's where that number comes from, but it's very much a 24/7 job that never ends. Compared to other caregivers, those who are taking care of persons with dementia are twice as likely to have physical or psychological problems. They are much higher risk of social isolation and economic distress, more likely to use medications. They're at risk for family conflicts, only half as likely to use healthcare, and most have a weakened immune system. So when we're talking about self-care, this is one of the things we use, and I'm going to go over this very briefly, hopefully at another time, or if you're ever at one of my classes, we'll go into this more. But if you look at this screen, this came out of another university and a professor, and realize that you can categorize people's feelings as either positive or negative, powerful or powerless. And so this is kind of where serenity, depression, anger is a negative but powerful feeling. And actually I would ask if there's any caregivers out there, could you type into the chat box right now any of your feelings that you associate with caregiving, whether it's good or bad. If anybody can just type that in, and I'll continue with this. So most of our feelings land in, if we look at our screen, in that negative, powerless, and so in that left lower quadrant. And so what we want to do is get to that powerful, positive feeling. So how do we do that? Okay, so a lot of it is that you are with your caregiver, you know what's going on, or whatever is bothering you, the repetitive questions, whatever is happening. And so what we say is just recognizing that and just sitting back and formulating a plan, just thinking about something. It's your chance to be a detective. Only you know what works. Just by doing that, you'll move up from this negative, powerless state to this negative but powerful. Just the fact that you are thinking about doing something. Then what you want to do is try it out. If you try it out, it works, great. Then you move to this powerful and positive place. If it doesn't work out, that doesn't mean that you failed. I just want to be clear on that. It just means that you've generated new information, and now you know what to do, and we can move on to the next thing. Think of it like us providers when you come to see us. You tell us a whole bunch of information. We have this whole list, and then we're like, this is what we think is going on, and we try it. Most of the time we get it right, great. Other times we don't, and we got to start over again. Contended involvement. This is a real basic schematic. So what this is saying for caregivers, and this helps caregivers, contended involvement means for the person that you're caring for, getting them involved in a task where they feel content, something that will engage them. Think about who the person was before. Did they like gardening? Did they like tools? And kind of see if you can fit that to them. And the fit part is to their stage. How much help do they need? How much can they do on their own? So, you know, for example, and sometimes try things they didn't like to do. We do have people who let their unloved one fold laundry, and then they finish the laundry, they put it in the basket, they come back around, they dump it out, they fold laundry again. Loading tables, or help them gardening, or people who like construction, we have them divide up the boats. We give them nuts and bolts, and they have a great time divided. And if you know that this activity that you're giving them can last 30 minutes or an hour, then you know how much time you have for yourself to implement one of your 6 pillars. So this is kind of a general overview of what caregivers do. They manage resources, they guide behavior, well-being, and daily life. So self-care, very important. Us caregivers, we don't do it. We're all guilty of it, but we need to. I always use the analogy from the plane. You have to put on your own oxygen mask before you put someone else's on, because you need to be able to take care of yourself. And the biggest way I get through to caregivers is I tell them, if something was to happen to you today, what would happen to your care recipient? Who would step in and take care? Where would they go? Because many times caregivers end up in the hospital and sometimes do pass away before the person that they're caring for. So what are some activities that I have my caregivers do? So here's one. So I have them break up a sheet, 15 minutes, 1 hour, 3 hours, an entire day. And you can break this up even less into hour and a half, 2 hours. And I have them think about what they need, what they want in life, what would help them to re-energize. And you cannot write down chores and running errands. It's not part of it. You got to write down what you could do in this free time that would help you to re-energize. Like for me, it's going to the beach, putting on some music and just sitting in the dark or sitting in silence. And the reason why I have this do this is because a lot of times with caregivers, once you start using Contended Involvement Fit and you can get your person engaged in an activity, you know how much free time you have. And instead of there sitting there and going, I don't know what to do with myself, I've never had an hour before, you can get this list out, you've written it down, you know exactly what to do, and you can go and do it. Kind of give this picture, because this, and from a lot of caregivers, it gives them a little bit of freedom, or that's how they feel. Another activity is that a lot of times people will offer help, right? How can I help you? Let me know. And caregivers are like, oh, no, I got it. Well, I tell them, don't do that. I want you to write down a list of things that people can help you with. So it's when they say that, you can say, oh, yes, you can. And this is what I need you to do. You can bring out this list, and on Thursday nights, could you please bring me dinner? And so a lot of these activities from the first activity, if I go back to that, and this activity, I say, think of things from those 6 pillars. It doesn't have to be. Most things fall in that. And pick things from the 6 pillars of health that you could do in these free times, or that people could help you with. And in that way, you're stimulating yourself. You're doing your own brain health. And then when you are with your care recipient, you can do those 6 pillars with them to help slow the progression of the disease. So reasons to do activities, I think all of us could agree with everything that's on the screen, and I'm sure there's a lot more to add to this. For me, it makes me feel energized, calm. I do love learning something new. And so, of course, you can always add to your list. Other factors that we need to remember when we're talking with our caregivers, our care recipients, is family and financial, mobility, transportation. I mean, there is an unending list, I think, of the things that we need to help. And as providers, too, we need to become more educated with the resources outside and kind of be able to bring the resources into one place so that we can help all of you and point you in the right direction. Living arrangements, equipment, services, that's a lot of ones that people ask me questions about. Motivation, family situation, health literacy. And so one thing that I don't want us to forget about is our family. And this is a picture of my family, or at least it was 9 years ago. This was the last time my father was able, my brother lived on the Big Island. It was the last time he was going to be able to fly. And a few years later, he was about to become bedbound. So it was one of the last times we'd all be together. So I very much know that this is a family issue. It doesn't just affect the person with the disease and maybe just their main caregiver, but everyone. So I try to not only help the 2 in front of me or the 4, but I very much encourage a lot of times to bring the whole family into the office so that we can talk and discuss things and help set things up. I want to do a lot of education, report, and services, resources, Important to also think about the different family dynamics. A lot of families some families work very well together, others may not, and there may be a lot of reasons for that. And sometimes some family don't help because they're not sure how to, or they're scared of the disease, or they don't want to see mom like that. And so there's a lot of different reasons, or they're not sure how to handle all those things that we talked about with dementia. And so just some quick tips as we stop right here is sometimes when your person with dementia is talking about maybe a person who has passed away, instead of reminding them that the person has passed, which can initiate the grief, that can make them grieve all over again, they might just be missing that person. And so it might be a great time to get some picture books out, or to tell them, tell me about Uncle, or tell me about about that. Let them express themselves, and then you can distract them into something else. Or if they told you that somebody dropped them off pie on Tuesday and uncle used to and he's not around, you know, just they just want to talk about it and they're missing that feeling. I get a lot of questions about the repetitive questions, and I'm thinking about things that family have asked me, and you know, they're not doing it on purpose. And so I think that one way I tell them to look at it is dementia, people with dementia, you know, the person that they kind of hold on to is kind of their security blanket, like how kids are. And so when they're asking those repetitive questions and those things, they're looking for you to make them feel secure because they're confused, you know, basically all the time, even though they have moments of clarity, especially in the early stages. And so if one of the visualizations we use is if you are driving in a car, it's at night, there's heavy rain, the radio is on, the kids are fighting in the back, the passenger is talking to you, you got Pepsi trucks on either side of you, and you're just in this really hyper confused state. Well, that's what it's like for them. And so they're looking at you for that calmness and reassurance. And then ending on family, we also very much want to take into account everyone's culture. Everyone's culture is a little different, and that'll help with family dynamics. And then lastly, I want to just kind of go over local resources. And so very much the Alzheimer's Association, Aloha chapter, we have here, and they have a plethora of resources online and here, support groups, they do community education, they do a lot of professional education. Again, we have Alulike, the Executive Office on Aging, Project Donna, HPGS is another one. We have Memory Friends, Gym Guys, Declutter Hawaii. Another one is Generations Magazine, UHM Center on Aging, and also things like Meals on Wheels, Lana Kilo Meals on Wheels can very much help seniors. And not only do they bring meals, but they help to put eyes on our kupuna and make sure that everything is okay. Here are some other resources that we have here. Catholic Charities, they can help just like with picking up and dropping off and taking people shopping. Hospice, in-home care, Keola Mama or Native Hawaiian Health Systems, a lot of senior fairs and helping hands. Here are some programs that are very much for the public as well as for professionals. Things like Dealing with Dementia from the Rosalind Carter Institute, Dementia Friends, the Positive Approach to Caregiving, National Task Group, and Savvy Caregiver Program. A lot of these programs I've been trained for, I'm champion for, and like Mapu goes out and teaches PAC, the Positive Approach to Caregiving, and I am usually with Dealing with Dementia or the Savvy Caregiver Program. Okay, and that's it for me today. So I hope everybody enjoyed it. I hope that wasn't too fast. We started a little late, so I wanted to make up for time. But thank you everybody for joining me today. And now we can get to some of your questions. So before I say anything about taking supplements, I will have to say that any information I gave today is very general information. So before you start anything or do anything for you or your care recipient, please check with your provider, whether it's primary care, a geriatrician, a neurologist, or your team. Please check with them or how they feel about everything before you start anything. Now, as far as you're asking about turmeric and gluten and other ones, so most providers will say, you know, if it's FDA approved and if there's some evidence behind it, and to please be very careful with any over-the-counter supplements that you would take on your own, like ginkgo. A lot of people like to take that where they haven't really found too much evidence. Now, turmeric or olena, especially, and la'au is used to decrease inflammation, among other things, and can be used for dementia. But again, saying that would probably be something that you'd want to do more research on your own, and maybe consult somebody who's very familiar with it, like a la'au lafa'au practitioner or somebody with Chinese medicine. But again, talk to your physician, because I don't know your case or your care recipient's case and the other medications they're on. There could be some interaction. There could be a reason why the provider doesn't want the person on it. So I would just always with caution when you're talking about other kinds of supplements. Oh, thank you guys so much for sharing. So Wiley wrote, I felt helpless when I cared for my father, as he had a hard time letting me help him. feeling love and what's best for them most of the time when things are going good. Kimberly and Anne wrote in and said, I was a caregiver until my parents passed in 1999. It was the hardest and best thing I ever did. It made me a vastly better person. I loved my mother's mind. She routinely went up the mountain, took the spaceship to London, where she had tea with the Queen. How can you not love it? I agree with everyone. So I always tell my caregivers, please focus on the positive, focus on what they still can do, not what they can't do. My mother had a really hard time losing her best friend, and she did tell me it's very different than losing your parents. I helped her care for both of her parents as well as her grandmother. But I understand the helpless part too. It affects all of us at any range, at any age, and a lot of times care recipients, just think about their pride. Of course, they have a hard time letting somebody care for them. So just step back. And sometimes we just have to do some things behind the scenes. Saying that, we also have to know when to step in. Because sometimes when people will say, I don't want to make that decision for them. I want them to still be able to, and you're sitting in front of the doctor or whoever. Well, sometimes when people with the disease know that they cannot understand, they can't think of it, it causes them more anxiety if we don't step in when we know we should, and we keep letting somebody else ask them questions. Again, going back to your helpless comment, I very much know how you feel. As a provider, my family kind of looked to me to save my father, and sometimes I feel very defeated myself that I cannot do anything to save him, that the only thing I can do is aid in the fight and help him have the best journey until the end. And as a medical person in medicine, it very much pains me inside that I can't do for my father what I got in this field to do. But I think we all can't focus on that. We need to focus on the positives and what the joy that we do give them and the time that we have with them. I'm a social worker. Do you have any suggestions for getting the older Japanese seniors, especially the males, to accept programs? That is a hard one. I know a lot of my patients and their caregivers who have the Japanese culture behind them really don't talk about things. My boyfriend was raised Japanese too, and so he had a difficult time with this. I will say though that I went to a support group. It's not the one, I do the Neil Valley for Alzheimer's Association, but I attend the IAL one, and there is a man there who is Japanese, and he said the same thing. It was hard, but his wife finally got him to go, and so even though his mom has passed away, he still continues to go. So that was kind of how I got my boyfriend to end up going to the support groups, was telling him, hey, there is somebody there. He's very much in the Japanese culture and spoke about this, but he comes, why don't you just try it? And that kind of got him into, it's really hard to penetrate the culture like that. And I think if you can just keep at it, maybe give examples, hook him up with somebody who else is going through it, and just keep encouraging. In the end, they usually see the benefit and will attend. It says, adult take care is an excellent and affordable alternative care venue with games, activities, socialization, and meals that slow the progression of dementia. Kilohana was excellent. Totally agree. And I think you should always put them in it. My mom goes to Project Donner's support group, plus they do activities, and then she goes to the Alulike Kupuna programs twice a week. And now I even got my aunties and uncles to join her. So they very much have fun. Another night they had casino night, they had ukulele, they had exercise. I think next week, Tuesday, they're going to walk around Chinatown. They have such a great time together. They've made friends. They hang out outside of the group sessions. They talk to each other. It's very good for them. So if you're looking at the screen, this is the bikes that I was, so where you see the mouse kind of hovering over. You can find this on Amazon or Walmart. It's the fitness pedals, and they're very inexpensive. And again, you can put it on the ground, and like how I have my mom when it's raining, she watches the TV and she just pedals away. Then she puts it on the desk and she works her arms. And so, it's kind of a 2-in-1 with that one. It's inexpensive and it's very easy to use. And play games out of it. Make a game with your kupuna, like, I don't know, how much can you do in 30 seconds? How fast can you go? I have one, so I sit next to my mom and we race. We race each other. Who can pedal the fastest? Because there's a timer on. You got to make things fun. Put it on the table. The two of us are on the table going like that. So you got to do things to just kind of make it fun so it's not so boring.
Okay, I have another question. She's asking, what do you think we should call adult daycare centers besides calling them adult daycare centers? It's a great circle of life thing from preschool all the way to adult daycare.
True. So although I very much agree, so this is what I've always told programs like Alulike called it the Kapuna Caregiver or Kapuna programs, which I think is great. The cultural aspect, something like that. The best people I think that should rename the program would be the Kapuna or the seniors themselves. I think we should ask them. Sometimes their voice gets lost, and I think a lot of times we need to listen to them. They very much know what they need, what they want, what they would like, what they don't like, what they want to be called. And so we attach these names to them, you know, even at 24 Fitness, the Silver Fit. And I think instead of us coming up with the names, we should ask them what they would like to be called, what they would like. And so that is usually my approach with my patients. I'm not there. This is a working relationship. We have to work together. So for me to help them, I have to understand where they're coming from, their perceptions, what they want, what they like. And only then can I help them. I can't just sit there and say, this is what I think, this is what I think you should do. No, it has to be a two-way relationship.
Well, if there are any more questions or comments, I see a lot of people have said thank you, Dr. Balaz. Thank you so much for being here today.
Thank you guys very much. I had a great time. I had fun. We'll see you guys again.
And if there are any other questions, comments, or concerns after this, please email me at hpgsmembers@gmail.com. I received a question via text message. So if anybody is interested in sending in text message format, let me know and we can work on that for our next one. Oh, I should probably show my face. Sorry. Anything else? Sorry, Pokii, before we end?
No, I just want to say thank you to everybody. I had a great time. Hopefully I'll see you guys again and, maybe break this up into every section and a little bit more in depth or a new topic. But have a great day, everybody. And I'll see you guys next time.
Cool, and we got some cupcakes coming. Thank you. All right, so I'm Mapuana, and I just wanted to do a little sign off here. The website is hpgs.org. We're a nonprofit that provides plenty of resources for the Kapuna, so please check us out. If you do have questions or concerns, again, it's Hawaii Pacific Gerontological Society, or the acronym HPGS, members with an S @gmail.com. So just let me know what you think, or if you guys have any more questions, I can shoot you Dr. Pokii's email address and phone number if she allows me to. But as a resource, we're always available. So let us know what you need, and that's what we're here to provide. So if there's no more questions, thank you all for coming in, and I will get that PowerPoint sent to you soon.
Thank you, everybody. Aloha.